Hi, I'm Siobhán Fletcher and welcome to the latest edition of our newscast. Can you introduce yourself for me first?
My name is Bev McClung. I'm a specialist in special care dentistry and I work for Manx Care in the community dental service.
So I'll tell you what, we'll get to this new exciting equipment in a minute. Can you just explain the community service? I suppose people, like I said, coming in might not know it's here. So can you just explain who you are, what you do?
So we're a community dental team that look after adults and children with complex needs. We take referrals from across the island from other dentists and also from other healthcare colleagues. Our patients are normally will have a significant disability or cognitive disorder, or they'll require some extra special care, which our team obviously have a different skill set to a general dental practitioner. And we work closely with our colleagues in the general dental practices to help them out whenever their patients need a little bit of extra care as well.
And so we're here today because you've got this new equipment and new room as well here. Can you tell me a little bit about that then?
So part of our role is to look after patients who use wheelchairs. And sometimes those patients can't self-transfer safely from their wheelchair into the dental chair. So to keep those patients safe and to also provide nice quality dentistry, we use a diaco ramp, which is a ramp that means they can stay in their wheelchair and it just tips them back. And we were using that before in one of our surgeries in between some cabinetry and the dental chair that's fixed to the floor, but it was a bit of a tight squeeze. So at one point somebody had a bright idea about knocking a wall down to make a big surgery and then using the Daco wheelchair ramp in the big surgery, and which would just make the accessibility so much better for these patients. So I went away and had a little think about it, and then I asked the Henry Bloom Nobles Healthcare Trust would they like to get involved. And I was really happy and excited whenever they were happy to fund knocking the wall down so I could put these two rooms together to make a huge big room for our wheelchair patients.
And we've just been in there and you do have all that room around it, so you can sort of move equipment around as well. I mean, what difference has it made then for you as a practitioner, plus, I suppose for the patients as well?
It was just exactly the right thing to do because we want to put the patient at the centre of the experience, and because we can move all the equipment all around the room to suit anybody, the patient really is at the centre of care here for that room. And we've now called it the Bloom Room. It's a huge big room. There's lots of space around. All the equipment can move, so we can even have big wheelchairs in there that we can place the equipment exactly where we need it. And in fact, we've had some really good feedback already from some of our patients who have come in and just noticed that the workflow just feels much easier for them. They feel nice and safe in the room. So it's so exciting to have it and be able to offer it to our patients.
I suppose then, has it been rewarding then to sort of have pushed for this and then straight away be getting that positive reaction from patients then?
Yeah, I think patients that we look after in this service, they fight their own battles every day. So whenever we started the battle for this room, we were very mindful that we were advocating for our patient group who, there are so many things stacked against these people when it comes to equity in healthcare. So it's just, the feedback we've had is so good, but it just makes us as clinicians feel that we're getting it right for the patients. So I'm so pleased we've done it. I'm so pleased that we got the funding from the trust, because without that we wouldn't have got anywhere with it.
And I suppose that relationship with the trust, is that something that you can look forward to in the future? Have you got any more things that you'd love to have? You got a wish list that you're going to be giving to them?
Yeah, they have told me that if I have any more good ideas, I should really come and talk to them as well. They have helped me in the past as well. I did buy, must be nearly 10 years ago now, it was a handheld x-ray device, which means I can take x-rays when I go out to domiciliaries. So that's when I go to nursing homes or the children's secure units, and that's helped a great deal as well. But again, it's about equity of care, because some of my patients can't come to the dental clinic. So I'm fulfilling that gap in the healthcare for those patients.
Spot on. Is there anything I've missed? Anything you want to add at all?
No, we just love doing this job. We just want it right for the patients, and it fulfills our need as clinicians to feel that we've done a good job. We've a great team here as well, so I'm really proud of all of them, and we do our exactly what we can for everybody.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.